Radiofrequency ablation is typically done for lumbar facet arthropathy or cervical facet arthropathy, which is a arthritis in the facet joints. It could happen in the neck, it could happen in the mid-back, it could happen in the low back. And typically, when you're much younger, these joints are gliding against each other nice and easy. And as you get older, eventually the membrane between those joints diminishes and ultimately they start grinding against each other, and that's when you have your pain. In order to be a candidate for an ablation, you need to first make a diagnosis. You need to confirm that the pain is in fact coming from the nerves that you and your physician believe they're coming from. So you take numbing medicine and you put it at those specific locations under X-ray, and that test injection called the medial branch block is typically done twice. And as long as you get approximately 80 to 90% benefit, so significant benefit with activity within 4 to 6 hours after those test injections, then one can rule in that your pain is in fact coming from those specific joints, and that is when you do the ablation. During the third step, the ablation typically involves taking a different kind of needle and parking it directly next to the nerve. So there's no cutting, there's no incision, there's no wound healing concern after the fact. And once those needles are appropriately positioned, the physician would ask you a series of yes or no questions to confirm that the nerves that need to be burned are directly adjacent to the needle, and the ones that allow you to move your body are far and away, thus attributing to the therapeutic efficacy and the safety of the procedure. Typically, the ablation takes about 40 minutes on each side, whereas the test injections that you do before the ablation take about 20 minutes on both sides. And the added time of the ablation is typically attributed towards that sensory and motor testing or that questioning between you and the physician. So what most patients need to understand is that ablation is a very interactive procedure. If you do choose to get sedation with the ablation in conjunction with your doctor, typically that will not be complete sedation. It will be more of a twilight or a max sedation where you'll still be able to interact with your doctor in a somewhat sleepier fashion, but still to guarantee the safety and the efficacy of the procedure with that testing. So typically after the ablation, it will take about 7 to 14 days for the procedure to fully work and help alleviate the pain that we're targeting. The peak effect of the ablation would probably occur around 2 to 3 weeks, and typically if I'm the one doing your ablation, you would see me in approximately 4 to 6 weeks after the procedure. In terms of risks of the procedure, beyond the typical bleeding and infection that you would have with any procedure, there is a theoretical risk of nerve injury. However, that's why the sensory and motor testing is very important. So as long as an adequate amount of time is being given to that piece and the patient is not overtly sedated, which we would not let happen, the nerve injury risk is largely negligible. In terms of how long the procedure lasts, most ablations typically last for 6 to 18 months. Sometimes it can last for a few years. Why doesn't it last forever? The reason for that is because the nerves can regenerate and come back. And if that happens, and if the pain is still just as bad as you remember it to be, then you would repeat the ablation at that time. I typically like ablation as a treatment option because it does not involve steroid being given again and again, which mitigates the risk of osteoporosis and bone degradation from happening for over a prolonged period of time for arthritic issues. And the other reason why I like it is because it lasts for a much more longer period of time compared to a conventional steroid injection, on the order of 6 to 18 months. So typically if you have an ablation for arthritis in the back and it doesn't work, the biggest thing to understand is that low back pain only, not leg pain. Low back pain only is not a surgical issue. Spine surgeons don't operate for back pain or neck pain. They operate for radiating pain going into the arms or legs. So if you still have persistent back or neck pain after an ablation, then at that time it's probably best to talk to your physician about spinal cord stimulation, which can be done for arthritic low back pain specifically. And that's a more advanced treatment option. Chronic pain is extremely complicated, both in the neck and the low back, and a lot of times it's very important to get context for why one's having pain, and can be very discouraging, especially from a functionality standpoint. And if you feel that your pain is inhibiting your functionality and your quality of life, please do reach out to your primary care physician or contact us here at the Iowa Clinic.